South Africa recorded 13,626 new COVID-19 infections in the latest 24-hour cycle. The National Institute for Communicable Diseases has also reported a further 523 deaths due to COVID-19 related complications. Now, this takes the national death toll to 71,431. Most of the new cases were reported in the Western Cape with 3,968, followed by Gauteng with 3,655. While the acting Health Minister Mmamoloko Kubayi says the department is still working towards vaccinating over 300,000 people per day. South Africa has administered over 7.2 million vaccines so far, with the department aiming to increase jabs in August. Currently, at least 215,000 vaccines are being administered daily. Now, let's discuss this further. We're now joined via Zoom by Dr Jabu Mtsweni, head of the Cyber and Information Security Center at the Council for Scientific and Industrial Research. Dr Mtsweni, thank you so much for your time this afternoon. Now, we know that about 40 million South Africans need to be vaccinated by March 2022 at least. The acting Health Minister Mmamoloko Kubayi says the government is still working towards vaccinating over 300,000 people per day. How achievable is this, considering that 14 million target?
Thank you, Unati, and thank you for inviting us into your show. I think in terms of the targets, the 300,000 mark, it's pretty achievable, at least based on the trends that we are seeing in other countries, and also by seeing the ramp up in the past couple of weeks, because as you have indicated, currently when we are looking just at the 7-day, average, we are sitting at about 173,000, and since May we've been ramping up, and I think if we get to let's say about 250,000 or more, we should be fine. What is obviously impacting the rate at this stage is the weekends, which tends to slow down the vaccination, because generally most of the sites don't vaccinate during weekends.
How bad are the numbers, if you look at weekday numbers and weekends? I mean, we're hearing numbers that are as low as 23,000 per day during the weekend.
Yes, so if you look like during the week, you get numbers that are above, 200,000. Of course, this week, as the minister explained earlier, there have been some slowdown, particularly, Wednesday. Yesterday was much better. But over the weekend, we actually get so low numbers around, on average, when we're looking just on July, around 26,000. For Saturday and Sunday, which is a very huge discrepancies, and that obviously causes the vaccination programs to sort of stall on weekends, which will impact on the targets eventually.
Now, there were a lot of terminologies obviously thrown during your presentation earlier. What does a multi-dose series mean for the COVID-19 vaccination effort?
So, as you indicated earlier, the target is to vaccinate 40 million people. So that's the number of people who needs to get the shots. However, when we look at the targets, we are also considering how many doses, does a particular individual need. So if you look, for example, at the J&J, where a person is only required to take 1 dose, so that technically means if there are 40 million people, the National Department of Health only needs to administer 40 million doses, But if it's a 2-shot a vaccine such as Pfizer, that practically means you have to double the numbers. And because people don't take these vaccines at the same time, so it means they will come one day and get the vaccine and get the shot, and then 40 days later and get another one. So that is what the multi-dose strategy actually means.
Now, if you just go back to the target that we were speaking of, that 40 million by next year, March, let's assume that 15% of that 40 million people decide that they're not going to be vaccinated. What would that mean for the vaccination process? I mean, we know that Afrobarometer survey found that about 54% of South Africans say they are unlikely to get a COVID-19 vaccine, and almost half say they believe in prayer and that provides more protection than the shots.
Yeah, so it's a difficult one, and I think we have seen this, globally in other countries that are much more able than us. But to answer your question specifically, if we are looking in our country at a 15% maybe hesitancy rate, what we are looking at starting from, let's say today, based on yesterday, on people that would require actually 54 million doses that will be required if we are talking about a two-dose strategy, and that will translate to something like 223,000 doses per day if we are to meet the target by March. But of course, one thing we know is that not everyone will take the vaccine. As we have seen, for example, in the UK, they have accelerated their vaccination program, and they are currently at about 49%. They have not reached the 67%. In other countries such as Israel, where they have very good health infrastructure and a very good program in terms of vaccinating, but they have not necessarily reached that target. In the US, it's the same. They're even trying to pay people to actually get vaccinated, because there's still a lot of mistrust about the vaccines and a lot of misinformation about it. But ultimately, we have also seen, in other countries where they've been vaccinated, that it's actually one of the best solutions for us to deal with this pandemic.
Now, let's talk about this. What about vaccine inequality? How has that hampered the country's vaccine drive?
No, look, the vaccine inequality is very real, and you would realize that African countries, we are not necessarily the IP owners of these vaccines that have been produced, and I think only 1.1% of the African population has been vaccinated. So that's very low, when you compare to European countries. If you look at China, they've already vaccinated over 1 billion doses. And of course, we probably also started late, the supply and also the delivery of this. We also had some other issues with J&J, where some of the vaccines were contaminated, but the inequality is very real. And I think South Africa is leading this specific process by trying to also manufacture some of these vaccines here at home, because the vaccination program is not just going to end in March. I think this is something that is going to continue for a while, particularly because now we are just focusing on the adults.
All right, Dr. Mtsweni, thank you so much for your time and your analysis. Dr. Jabu Mtsweni, head of the Cyber and Information Security Center at the Council for Scientific and Industrial Research. Thank you so much.